Hello everyone! I don't know about you, but last week felt like such a long week. It felt like a month condensed into 1 week. And looking back, I think two of the reasons why it felt that way is because one, the inauguration happened and everything surrounding that. But the second reason is because I got the second dose of the vaccine and it was rough. And so the two things that I'm going to be talking about in this video have to do with these two major events. One is I'm going to start off by talking about my experience with the second dose of the vaccine. I'm also going to address some frequently asked questions that I keep on getting asked on social media, especially on Instagram and TikTok. And then I'm going to get into President Biden's national strategy for COVID-19 moving forward. And there's 7 major points, and we're going to quickly run through all of them and give you my first impressions of this 200-page document that I've skimmed through so that you don't have to. I think that it's really comprehensive and worth knowing about. So I got the first dose of the vaccine a couple weeks back. I made a video about that then. Really at the time I only had a little bit of arm soreness. And of course I decided to get the vaccine not only to do my part in public health and addressing the pandemic, but also for personal reasons because I work directly with COVID positive patients and I do aerosolizing procedures where I'm directly exposed to the virus. So you can consider me at a high risk of contracting the virus. I got the Pfizer vaccine, which is why the second dose came in that window period of 19 to 25 days after the first dose. And the response to this dose of the vaccine was completely different. And I had heard for a while that a lot of the people I knew who got the second dose of the vaccine had more symptoms that they developed after the second dose. And that's exactly what happened to me. So on Wednesday morning, I got the second dose, didn't really feel much. By the end of the day, I was starting to get some arm soreness, actually less than I'd say my first dose. But the second day I woke up, was starting to feel a bit weak and not chills, but a little bit cold. And fortunately for me, by the second half of the day, I had the day off. I was able to take a nap, but I was already developing a bad headache. I was getting kind of weak and achy all over. Nothing upper respiratory, fortunately. Nothing really GI either. Diarrhea, abdominal pain, loss of appetite, nausea. None of that, fortunately. And as quickly as the symptoms came on, they all disappeared. So the following day I woke up and it just felt like a new day. And I felt so much more relieved that I finally got both doses. So instead of getting only about 50% efficacy, I was moving myself towards that goal of that 94, 95% that's quoted from the studies. Now, of course, I want to take the opportunity to also clarify some frequently asked questions that I've been getting on social media about the vaccine that I don't think I addressed in the first video. So do we know if the vaccine will truly prevent infection? And the answer is we don't really know. We know that the vaccine will decrease severity of disease, and following that logic, if we're not able to develop symptoms from serious disease, we're also less likely to transmit the virus because we're not coughing and having those types of symptoms. Do we know how long immunity will last with the vaccine? Simple answer, no, we don't quite know yet. Will it alter your DNA? Well, considering that the Moderna and Pfizer vaccines are mRNA vaccines, they do not enter the nucleus of the cell, the center of the cell where your DNA is housed. Therefore, it will not alter your DNA. Will you suddenly get microchipped? No. Was the development of the vaccine rushed and therefore not thoroughly studied? No. Because of funding and the urgency behind the situation, they were able to amass a lot of people for these trials. It was thoroughly studied. There are independent bodies that evaluate these sorts of clinical trials as well. So rest assured, it was studied the way it should have been. And no, it's also not rushed because we have experience with SARS back in 2003, and the knowledge of a coronavirus and developing a vaccine are not something new. This is something that we've had to quickly adapt to the novel coronavirus that we're dealing with now, but that process was started long ago. Now, shifting gears a little bit, I want to talk a little bit about President Biden's COVID-19 national strategy, but before I do so, I highly recommend that you check out this half-an-hour documentary by the Taiwan CDC. Although the documentary is in Mandarin, they did come out with a version with English subtitles. What it's about is basically Taiwan's initial response to the pandemic and what things could have been, what an appropriate pandemic response looks like. To date, they have under 900 total cases and only 7 deaths out of a population of 24 million people. I do want to point out that there are certain parts of their approach in Taiwan that have obviously worked very well there, but wouldn't be so successful here in the US. First of all, Taiwan has a national healthcare system, which means that all the medical records are centralized. They were able to link up immigration records to national health insurance records so that they could track basically anyone who had recently traveled out of the country, especially to China early in the pandemic. Taiwan is an island nation, but it is very close to China, and that proximity simply can't be ignored because that's part of what happened with SARS in 2003. Now on that note, Taiwan's experience with SARS has truly informed how they responded to the pandemic this time around, and the fact that they were very prepared for something like this happening again. And culturally speaking, the culture is completely different. Obviously, here in the US, there's a lot of emphasis on independence, on freedom, on liberty, and that has allowed America to become the superpower that it is and to allow Americans to succeed in the global arena to this point. But when it comes to the pandemic, regions that really focus more on community like Taiwan truly shine through. But maybe that'll change with this new national strategy that President Biden has outlined for us in this 200-page document that, yes, is hella long, but is super comprehensive. He's outlined 7 major goals, which let's just list them right now. The first goal is to restore trust with the American people. The second goal is focused around the vaccination campaign. And the third goal is mitigating spread of the virus by expanding mask wearing, testing, data collection, treatments, etc. 4 is expanding emergency relief and enacting the Defense Production Act. 5 is figuring out how to safely reopen schools, travel, work, etc. 6 is protecting at-risk groups by focusing on racial health disparities or rural-urban disparities. And 7 is bringing the US back into the global landscape of health leadership. And the way I look at this new national strategy with President Biden is partly informed by my understanding of how Taiwan has dealt with this and my own personal experience having lived there when SARS happened in 2003. So for goal number 1, restoring trust with American people, I think it's a really tall order. A lot of the things that President Biden outlines here is, providing people with data and science and backing it up with evidence. But I think that we have a fundamental issue at hand in the US where people simply don't believe in science. No matter what sort of numbers and data are thrown at them, there's always some explanation or conspiracy that people rather believe in as opposed to how the science is actually conducted. But one of the action items under this goal is really engaging with the American people and having regular press briefings, which I think is really important. In Taiwan, even with 7 deaths and none since April last year, they still have daily press conferences that people can tune into. And there's even text messages that you can opt into to get daily updates. And because there are so few cases, for every new case, they publicly disclose kind of how the person is doing, what the situation was with this person, and so people can learn from those experiences. That might not fly in the US considering how we have thousands of cases and thousands of deaths every day, but I think that greater transparency is certainly something that we need. So with the second goal, with focusing on vaccinations, as many of you have probably heard, President Biden has very lofty goals about getting the vaccine out to more people in a very short amount of time. Up until now, the rollout has been slower than expected. I also do think that it's really great that there is this focus on equity, but sometimes the people who are most at risk and most disenfranchised also are not only at risk of contracting the virus, but also of spreading the virus as well. If we can get the vaccines to these high-risk groups, I think that's really important as well. I love how they outline trying to reach harder to reach populations like tribal nations, senior citizens, etc. Making sure that there's no out-of-pocket cost for vaccinations, making sure that barriers to vaccination are addressed. I think that identifying a lot of these barriers, honestly, will also help break down barriers for healthcare in general, because a lot of the things that exist out there that are barriers apply not only to vaccinations, but other issues as well when it comes to our health. They also go into supporting states with federal resources, which I think is really great. And again, focusing on transparency of the whole process. I can imagine that there's probably gonna be a lot of hiccups along the way. It's not gonna be perfect, especially with how complicated our healthcare system here is. And it really looks like he's trying to bolster the healthcare workforce to administer these vaccines and potentially even have them go through retailers or grocers to increase the vaccination rates around the country. And it's so interesting that this is even an issue here in the US. I know that it's not unique to the US, but in areas like Taiwan where the scientific process is trusted and public health leaders are trusted, it's almost not even a question that people will get vaccinated when it comes available to them. And the third goal about mitigating spread by increasing masking and expanding testing and data collection, I don't think there's a whole lot to say about this. Again, I think culturally, this is something that's going to be difficult to overcome because people who aren't willing to wear masks just aren't willing to wear masks. And yes, I think this is a great move to move towards mask mandates. I honestly don't know why it's become such a big issue here. I think it's an inconvenience. No one will deny that. But when we're weighing the trade-off between the risks and the benefits, goal number 5, focused on reopening schools and workplaces, etc. There's a certain amount of attention that the national strategy puts on not only physical health, that the coronavirus can potentially impact us, but also the impact on mental health and the understanding that, this has really disrupted people's lives at home, especially with their kids, if they have to, be committed to virtual learning, how it's affected small businesses. I mean, I live in Philadelphia and you can see it very visibly how restaurants and stores are closing down one by one around the city because people just can't simply afford to stay open without enough traffic coming through their stores. And I think the key difference between this strategy versus the lack of what we had before is that at least there's a plan for reopening schools and how to do it safely. I mean, the strategy goes into paid leave for people who go into quarantine and isolation. It goes into providing multilingual resources to small businesses out there. And we'll see. I mean, just like masking policies, I feel like a lot of these, there's just like very little guidance. And so the approach everywhere varies so much by state, by city, by region. If we had a standard that we could all follow, I think that might be more helpful. Goal 6, I think, is super, super important, and that's ensuring equity. I think this is super important because certain groups like Black individuals already have a disrupted relationship with healthcare here in the US. They have very good reasons not to trust American healthcare because of what's happened in the past. And I think that being able to address some of these concerns and focusing on certain groups and addressing what their doubts are with healthcare, I think is going to be really helpful. I think it's always easy to lump everybody working in healthcare into one group, but there's just so much variation. I myself, and I know many, many other people, are very committed to making sure that there's as much equity as possible, which is difficult because so much of health and what impacts health is kind of out of our hands. People's living environments, what they have access to, insurance providers, etc., having a primary care doctor, having a good relationship with a health professional, all of that is so variable across the board. And so sometimes, as much as we as individuals want to help out, we have to rely on the government to sort of level the playing field out a little bit as much as possible. And that takes a government that wants to do that. And I think that this strategy actually does put forth some very tangible action items, like increasing funding. Like, there are a lot of these ideas that sound really great, like, oh, we're gonna expand this and we're gonna institute that. But I think funding and other elements that really impact the logistics of executing this plan successfully have to be addressed. But even down to ensuring that different groups are well represented in the clinical trials, and they have a whole special 2 pages devoted to other at-risk groups like older adults, adults with chronic medical conditions, refugees, congregate settings like homeless populations or correctional facilities. So I do think that there are some tangible items that are being put forth here. Goal number 7 is restoring US leadership globally for future preparedness. And what I have to say about this is that Taiwan did all of that without needing the WHO. And I believe that the US had everything it took to respond appropriately to the pandemic. We had a pandemic playbook. We just didn't follow it. In the future, obviously, to prevent a pandemic that's affecting the world, we should be actively playing our part in preventing that from happening. And not to forget that, when the US suffers economically, there are ripple effects across the globe. Our world is so interconnected now that we have to move away from this America-centric mentality and really see ourselves more as a global community. And as much as I'm very bullish on this national strategy, I know it's going to be such a challenge to actually pull off. I think one of the key challenges is that our country is pretty divided right now, and one of the ways to really overcome that, I think, is to just talk it out, ask questions. If you have doubts, talk to experts online and people who may even be outside of your own comfort zone, people who you usually might not agree with, get their perspective and hear what their explanation is. Now, if you want to review the national strategy on your own, I will leave the link in the description box below. I'll also leave the link of the Taiwan CDC documentary down there as well. If you want to watch it, I highly recommend it. And if you like this video, please give it a thumbs up. Remember to subscribe by clicking the red button below and turn on the notifications bell to be notified every time I upload a new video. I'll probably go back to gut health related content really soon, maybe in my next video. Usually I am trying to upload every Sunday now. And if you want to follow me on any of my socials, I will leave the links down in the description box below as well. All right, well, until the next time, please stay safe and healthy. Don't forget, even if you get vaccinated, you have to keep wearing your mask, wash your hands, all the usual precautions, and I will see you in my next video. Bye.